Wendy Jones, and you're listening to The Patriot FM 101.5 AM 1400. We're here today with Rakel Assk and New Life Medical, and what a great program today. If you have any kind of pain, let me just tell you, you've got to make the call. In fact, give your phone number one more time, Rakel.
Yes, of course. Our phone number is 248-952-9190.
So we were talking about PRP. And I'm not
Yes.
even going to try to say platelet-rich plasma.
Plasma.
And you mentioned that you can use it for shoulders, knees, and elbows?
Correct. So we take your blood and we spin it, and you can inject it into any of those joint spaces. And we only treat those specific, you can actually inject it into the hip, you can do the ankles, you can do a bunch of different areas, other joints. The only issue as to why we don't do it is because we don't have our machine, our x-ray machine, only treats small joints, so we can't do the bigger joints like the hips.
Yet.
Yet.
Okay.
Yes. And my patients will always ask, how long do I see results in with platelet-rich plasma? And I always say it's essentially permanent after one. It varies based on the patient, but you could, most of my patients say they get the best relief after the third injection.
Okay, so it could be one, but
It
you
could
get
be
up
one.
to 5 as well?
Up to three.
Oh, up to three you said,
yes.
okay. And so tell us what types of injuries or like tennis elbow? Like what are we talking about?
Yeah, of course, yep. Tennis elbow, I have rotator cuff injuries that I see a lot, osteoarthritis for the shoulder,
really?
yes.
Instead of surgery?
Yep, of course.
Why not?
And then muscles, ligaments, and tendons that are broken down. I get a lot of, with the knees, I get a lot of meniscal tears. It'll help heal it. And then I get a lot of ACLs and MCLs and yeah.
So my husband had ACL surgery.
Oh, he did. Okay.
So he wouldn't be a candidate for
He-
PRP?
he definitely would.
Bothering him again?
He would. He would be a candidate. Any type of ACL or MCL surgeries, any type of ligament or tendon surgeries, you can get alternative therapy for. It's the total knee replacements that you cannot.
Right.
Yes.
Okay. All right. And so how long does the relief last? You said forever?
So yeah, it could be essentially permanent. It'll last at least 6 months, and then if you get the pain back at that point, that's when you would get another injection of PRP, and then up to 3, it's essentially permanent.
Wow, that's
Yeah.
amazing. Okay, can you give us, I know I'm not going to quote you, but can
Yeah.
you just give us an idea of a range of how much this costs?
Yeah, of course. So at our clinic, per joint, we charge about $500 for the injection of platelet-rich plasma for one.
And that includes everything. That includes you drawing the
Yeah,
blood,
everything.
blah, blah, blah.
Everything.
Okay.
Total, you walk out spending $500. Yep.
Okay.
Mhm.
And that's for each one, and you can get up to 3.
Yep.
So.
Up to 3. Yeah.
Okay, so talk to us a little bit. I mean, I think that's fascinating, and I don't know why someone wouldn't want to try it, except that they maybe didn't have the financial means to do it.
Of course.
But
yes.
you're probably going to pay a copay for any major surgery
Yes,
anyway.
of course. Or a deductible.
Yeah.
Deductibles you have to meet for the year in order to do any type of surgery. So why not pay the $500?
I seriously have often wondered if surgeons are busier in September, October, and November, and December than they are, because everyone's doing everything they can to meet their deductible before they have surgery.
Yes, I actually have an excellent success story with PRP.
Okay,
I'd love to share. So I had a patient who is a soccer player, and he is in his 30s, and he's had multiple ACL injuries, and he was over it, and he could not play soccer like he used to. So he came on in, and we gave him a PRP injection, and he only had one. And I still follow up with him, and this was about 6 or 7 months ago, and I still follow up with him, and he's like, it changed my life. I can play soccer better than I ever could have. After I would play soccer, my games, right after, I would have all of this pain, and I would say I can't play for another week or 2 just to,
It would literally
to heal.
keep him from the sport.
Yeah, exactly.
Right?
And now he's like, I'm playing 2 to 3 times a week, and my knee has never felt better. And I'm like, oh, I love you.
Why not?
Yes.
I mean, it's like, what a win.
Yes.
And
of
any
course.
age, or you have to be 18 and older for the PRP?
18 and older.
Okay.
Yeah. Mm-hmm. Yes.
Okay. All right, so let's move into the stem cell therapy.
Yes, of
That's
course.
FDA approved?
Yes,
Okay, talk to
FDA
us.
approved stem cell therapy. So stem cell therapy is your gold standard. So stem cell therapy is the absolute best therapy that you can do, other like in your alternative therapies other than surgery, right? So we offer stem cell. Stem cell comes, we get it from a donor bank. It comes from umbilical cord donors. So mothers who give birth and then they say they want to donate their umbilical cord. So all the stem cells within the umbilical cord we take and we inject into the knee. So all the damaged cells and all the broken down cartilage within the knee, what this does is all these new young cells attach to the broken down and damaged cells, and they regenerate the cartilage that's lost and all the damaged tissues within the knee. It's your gold standard. It's the absolute best of the best. And it is so interesting, and all this new science that's coming about. And this has been going on for a very, very long time, stem cell treatment in Europe. Actually, it's been going on for many, many years. But the U.S. recently just brought it on, but unfortunately insurance won't cover it. I know.
Okay, so talk to us about how much it costs.
So it's really expensive because the donor bank
it's the
is
gold
really
standard.
It's the gold standard. Yes. So it's about $5,000 per treatment per joint. Yeah.
Wow.
It's pretty expensive.
But the chances of it working
are very high.
Are extremely
Yep.
high.
And it's very patient specific. When we have patients come in for our consultations and they are interested in stem cell, I'm very honest about it. I don't want you wasting your money. I tell you, I think you're going to get an 80% improvement. I think you're going to only get a 40% improvement.
Is it worth the $5,000?
Yes, exactly.
Right.
And that's your decision. Yes, most definitely.
So have people tried the first two things we've talked about and then gone to stem cell?
I actually have, yes,
Okay.
most definitely. I've had a patient who has tried tried platelet-rich plasma first, and he had some relief, but he wanted like that extra relief. So we did stem cell on him, and he is doing great. And
how long has it been?
It's been over a year, and stem cell will last up to 7 years.
God, you just wonder someday if all of this would be covered by insurance.
Yeah, I know. I keep telling myself that I think it will within
in
the
your
next
lifetime.
10 years. Within the next 10 years, I think it will.
I hope so, because it's such an answer to our problem.
It is.
And we obviously have an issue with our insurance.
And regenerative medicine is huge right now. It's you're using stem cell for many different things: multiple sclerosis, Parkinson's. There's multiple different things that stem cell is being used for.
I know. So you can use it on any joints.
Any joints, yeah.
That you wanted to.
Yep. In our clinic, we do same concept. We do the shoulders, and then we do the knees.
Okay.
And then the elbows.
Wonderful. So give us a quick recap. We only have a few minutes left in the program of just an overview, because some people may just be tuning in, and we talked about a lot of information today.
Yeah, of course. So a little recap is, our main objective at New Life Medical is to help people to alleviate knee pain without surgery. We want our patients to be able to continue doing all the things that they really, really love in life. This may be taking nature walks, playing golf, gardening, or playing with their grandkids. And maybe it's simpler, maybe it could be even simpler than that, but that's what we're here for. We want to change your life, and we want you to be able to go to sleep without having pain. We want you to wake up without having pain or having that stiffness, or tying your own shoes, or being able to shop without having to find a place to rest. Whatever your wants or needs are, we're here to help, and that's what we do at New Life Medical, and we look forward to seeing and treating more and more clients and getting this pain relief.
And you encourage people to be active in water aerobics
Yes.
and all these different opportunities that they can take advantage of.
Of course.
And it sounds like you have a really good relationship with your patients
Most
too.
definitely. My patients are everything to me. We build such strong relationships with them, and we always have them, we tell them, please just come by, stop by.
Well,
please.
it's life-changing.
Yes, of
you
course.
have changed many people's lives.
Yes.
They want to be able to walk the mall in the
Yes.
morning, and they can't.
Yes.
Or they want to be able to, like you said, go to
Mhm.
Cedar Point with their grandkids, and they can't because they
Of
can't
course.
walk.
Yeah. And we have many testimonials from patients that we've taken over the past couple of years, and patients have, wrote down or their testimonial of how this story about how this has changed a life.
So can you just share your contact information again with everybody,
Yeah, of
please?
course. So our office phone number is 248-952-9190. We are located in Beverly Hills, right off of 13 Mile Road and Southfield Road.
And your phone number again?
Our phone number again is 248-952-9190.
And I just want to remind our listeners, September 25th, don't forget, Wednesday, 9:30 to 12, at the OPC, there is a program, and it's for caregivers. It is called Caregiver Survival Plus, Caring for the Elderly with Dementia. So many of us are caring for people, and we need to be cared for. So this is a free seminar. I just want to encourage you to RSVP. The phone number is 1-833-262-2200. And again, the Area Agency on Aging is putting that on. And then also don't forget about the dementia conference that we're doing on October 25th. And we did a whole program on that last week, and hopefully you heard that. If not, you can call the office. My number here is 248-651-5010. Just wanted to throw those two things in. And thank you, Rakel. Thank you for everything you do. Really, I love your passion for people.
Thank you.
It's awesome. And why not call New Life Medical? You guys do just a phenomenal job for people. So thank you for changing lives. That's what it's all about. You're listening to The Patriot, FM 101.5, AM 1400.